vascularization. So that's the extent of tissues, of blood vessels within your tissue. Tissues in your body that have high metabolic needs, your brain, your skeletal muscle that is constantly moving, your heart and the liver, has more blood vessels because they have large energy needs. So more blood vessels if it's a high energy part of your body. Other structures don't have a lot of blood vessels or vascularity, or they even have no blood vessels. Your tendons, your ligaments, the epithelia, cartilage, and the cornea and lens of your eye have 0. One cool fact is this concept called angiogenesis. Your body can make new blood vessels when it needs to increase perfusion or supply of blood to the tissues, and it can occur over weeks to months. Some examples. When you work out, when you're training aerobically, it actually causes your skeletal muscles to make more blood vessels to supply it with oxygen. If you gain fat, maybe you might gain fat over winter break. I'm thinking about it. You're going to gain adipose tissue, which is fat. If you gain 1 pound of fat, 1 pound, your body has to make 7 miles of blood vessels to supply it. 1 pound of fat, 7 miles of blood vessels. Also, in your heart, coronary blood vessels can be prone to gradual blockage. The opposite of that, the opposite of growing blood vessels, is when they regress, or kind of shrink in. Returns to previous state. So if you were really active and then you become a couch potato, your blood vessels regress. If you lose weight, you lose blood vessels. Cool. The myogenic response, remember I said this affects blood flow. This is the relationship between your tissues adequately receiving blood regardless of your blood pressure. Okay, so you have smooth muscle, like I said, in the walls of your blood vessel to keep the blood flow relatively constant regardless of your blood pressure. So if your blood pressure increases, more blood is going to go into the arteriole. It's going to stretch because more blood's coming into it. It has stretch receptors that will feel that stretch, and in response, it will contract, thus keeping blood flow to the tissues at a constant level. Blood pressure increases, arterioles constrict to keep blood flow constant. On the opposite end, if your blood pressure decreases, goes down, those arterioles will get larger. There'll be less stretch. So they'll expand, still keeping blood flow constant. That relationship between blood pressure and constriction or relaxation is called the myogenic response. And the amount of blood flow to your body, total blood flow, is a unit through the vascular per unit time, and it's equal to your cardiac output. So it's about 5.25 liters per minute at rest. You exercise, it should go up, thus increasing the blood to your tissues. So regulation or the control of blood flow to your tissue depends on the activity of your heart and the activity of your blood vessels. And that is the end of part 1.